you need to have MD orders because the frequency is not just part of the care plan, but it's the main part of the care plan in that it tells you how many visits you need to do in what period of time. The rest of the care plan is telling you what you need to do during those visits. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about frequencies. This is part of our basic charting series where we intro charting concepts to people new in the industry. So if that's you, welcome. But first, if you like our content, please like, share, and subscribe. So let's jump right into it. What is a frequency? This is part 2 of basic charting concepts, meaning if you're ever going to work in any kind of healthcare field, specifically home health and hospice, you really want to have a clear understanding of this. If you do already work in a home health or hospice agency, you've probably heard the word frequency, generally know how to read one and can understand one. So this is very much for people who will be touching charts but have never before touched a chart. And of course, non-clinicians. So what is a frequency? A frequency is the schedule of visits that are planned and allowed for patients within the episode. Typically, the frequency will span the entire episode. However, there are variations to this idea. But first, let's jump into defining a frequency, and then we will talk about like examples and just kind of like how things can be different and things like that. So when we are evaluating a patient, we're generating a plan of care. In the plan of care, you have various components, and one of those components is called a frequency. Frequencies are a required part of care planning because they describe how many visits are allowed to be done within what number of time over how long of a period. If you think about it in kind of like mathy terms, think about the idea that a frequency consists of X, Y, and Z. X is the number of visits. Y is the period of time. And Z is for how long. So, for example, one common frequency can be in home health 1 week 9. That means you are going to visit the patient once a week for 9 weeks. In this case, X is the number 1, how many times. Y is weeks, so the kind of length of time or the measurement, unit of measurement of time. And Z is how many weeks this frequency can go on. Typically, frequencies are written for consecutive weeks, months, or whatever. So if you have 1 week 3, that means for 3 weeks in a row, you need to visit the patient once a week. It can't be like 1 week you visit them, 1 week you don't, then you visit them again. It's not any 3 weeks within like a time frame. It's consecutive weeks. Now, in the concept of X, Y, Z, where X is the number of times, that number could be anything, right? Like 1, 10, whatever. Y, the unit of measurement, is typically going to be day, week, month. It's usually not like you're not going to express frequencies in years. But the point is it's a unit of time. So 1D1 is once a day for 1 week. 1M3, once a month for 3 months. So what are we really being told when we have, let's say, 1 week 3 frequency for nursing? We're saying that the nurse has to go once a week for 3 weeks. We are also saying that it doesn't matter where in the week they go. So that doesn't mean they have to go every Monday for 3 weeks. They can schedule that visit anytime within the agency specified calendar week. So one of the things that agencies do is they have like exactly what is your week? Does your week start on Saturday, on Sunday, on Monday? Like, where does your week start? A lot of agencies will typically have their week resemble a calendar week. So we're going like Sunday to Saturday. Some agencies have their weeks going Monday through Sunday. So this is like an important idea to understand about your agency is like, what is your calendar week? Because if your visit's on Sunday, it's important to know if that's the previous week or the next week. Usually agencies will just do it calendar week style, but we have seen people choose like Monday through Sunday as the week. The next idea for frequencies is that when you have a frequency within an episode, typically it will span the entire episode. So in home health, that's about 9 to 10 weeks, depending on where you start in the week. For hospice, that's 9, 10 to 13 weeks, depending on what benefit period you're in. If you want to learn more about this, please watch the episodes video that really breaks this down. So typically, we are going to set a frequency for the whole week. A typical home health frequency for nursing, for example, is 2 week 2, 1 week 7. So that means twice a week for 2 weeks, and then once a week for 7 weeks. There's no space in between the first section and the second section. So you can have frequencies that give you different amounts of visits. You just separate them by a comma. So for example, in this case, you have 2 week 2, comma, 1 week 7. In this example, the final 2, right? Not the first 2 week 2, but the second one, the 2 weeks. And that 1 week 7, the 7, equal 9 weeks. We have now spanned the full episode. Unless you are there for some kind of special treatment, like IV, for example, 1 day 10, once a day for 10 days. Usually, side note, whenever we have once a day, twice a day, or 3 times a day frequencies, in medical terminology, we are writing QD, BID, or TID. QD is every day. So that would be QD 10, BID times 60, whatever. TID 3 times a day, times like 10, whatever. Those cases are going to be for usually like injections or IVs, things like that, where you're going multiple times a day to perform a service. So unless you're going for something like that, like IV or wound that has like, okay, for 10 days, do this, and then you're out. Like the patient comes to you only for that reason, and past that reason, you really have nothing to do there. They don't need like medication management or treatment. Like they don't need teachings. They just need you to heal their wound or give the IV. So typically, you're not going to set a frequency that's shorter than an episode unless you're there for a specific treatment and nothing else. Because the initial evaluation should cover enough treatment for the whole episode. If you don't, then you're going to have to reevaluate for further frequency. This is because the evaluation, as you've probably learned in the episodes video, the evaluation is done by an evaluating level clinician, or in the disciplines video or whatever. The treatment, unless it's something like IV or something that requires the skills of an RN or a PT, whatever, will often be done by an assistant level clinician. So for example, or a treatment level clinician. This will be your LVN or LPN, your physical therapy assistant, things like that. They cannot evaluate for further visits. So if you have a short frequency, you will need to send the evaluation level clinician again at the end to evaluate for additional visits. So agencies will typically set the full episode unless they're only there for a short reason. The frequency is part of the care planning process and the MD order. So you cannot deviate from the frequency for any reason without MD approval. So what does that mean? That means if you have a missed visit, it needs to have a corresponding MD order that day. But what is a missed visit when you have a whole week to complete it? So generally, what you want to do is have your clinician schedule at the beginning of the week as much, or, at the beginning of the unit of measurement. So whether it's month, week, whatever, at the beginning of that time, to the best of their ability. Sometimes patients will be like, no, I need end of week, and that's that. Or the clinician is just like filled up. But you want to, if you can, schedule towards the beginning so that if the patient cancels or anything happens, you still have more time left to make up for that miss or that change without triggering a missed visit requirement. Whenever you have a missed visit, it is not acceptable in healthcare to have these things because your staff is busy, because your staff is whatever. It can't be your fault. Because you know what? If your staff can't make it, then you shouldn't treat the patient. You should send it to a company that can treat the patient according to the care plan. Or if your staff has some issues, you need to restaff to a different staff member for that length of time until that initial field staff can take it over again. The missed visit can never be because the agency just can't do it for this reason or that. And so the only acceptable reasons for missed visits are patient cancellations. But if they cancel at the beginning, right? You're scheduled at the beginning and they cancel, you need to show, including in your MD order for the missed visit, that you have attempted to reschedule and just the patient was not trying to reschedule it. So this is a really big important concept in healthcare, that any deviation to the care plan cannot be your fault. Yeah, of course, if it's medically necessary and then you're coordinating with the physician agrees with it, blah, blah, right? That's not a deviation from the care plan. That's now an addendum or an update to the care plan. That's a little bit different. But if you're like, oh, I forgot to do this treatment, or I forgot to do this visit or whatever, or I had too many patients scheduled and I couldn't schedule it, those are not acceptable reasons for missed visits. So your MD orders need to always explain the reason for the missed visit, show your attempts to make up for it, and you have to make sure that it's not your fault. That meaning okay, even if it's the fault of your field staff, let's say that you try to restaff. So let's say, for example, your field staff gets sick, right? It happens, nobody's fault, blah, blah, blah. They get sick on Tuesday and they can't do any more of their visits. The only appropriate kind of response to this, if that then becomes missed visits, is that you attempted to restaff to somebody else and the patient refused a different clinician and only wanted to wait for their clinician. This is the only acceptable kind of justification for this. And so when you have these situations, you need to make sure that you are restaffing as soon as possible to somebody else. You're documenting all of this stuff. It's really important. When you have a missed visit, that missed visit order also needs to have what the remaining frequency is going to be. Because the doctor might tell you, you know what, you missed this visit this week, make it up next week. Now, next week, you were going to have one visit, now you're going to have two. Or maybe the doctor says, okay, whatever. The next week, just resume the remaining frequency. Then now you have 1 week, but you've done one less visit overall in the treatment. Whatever that situation is, as long as it's approved, initiated, or ordered by the doctor, you're fine. You just need to make sure that missing stuff and not adhering to the care plan is not because of your agency. And this takes a lot of management and kind of like work on the side of your staffing personnel. Other adjustments to frequencies are always going to be care-based initiated. Like, for example, right? Like we did like 2-week 9 frequency in home health, but the patient met all goals by 7 weeks, so we're discharging early. That's okay. That's fine. That is an adjustment to the frequency that the physician approves to discharge early. Other adjustments could be like patient refused this discipline or patient needs a couple of weeks break for the discipline. As long as it's patient initiated, it's fine. Whatever it is, you need to have MD orders because the frequency is not just part of the care plan, but it's the main part of the care plan in that it tells you how many visits you need to do in what period of time. The rest of the care plan is telling you what you need to do during those visits. But what you need to do without how many visits you get to do it in what time frame is like nonsense. So step 1 is always going to be your frequencies. So that concludes our general overview of frequencies as they relate to home health hospice and just generally our basic charting concepts for new staff for home health and hospice agencies. My name is Mariam Treystman from the Home Health Consultant, and if you like our content, please like, share, and subscribe. Thank you.